Good evening. My name is Dr. Khaled Sadek and you're watching my YouTube channel on cysts and lipoma removal. Today is quite special because I thought we would do a live chat across the world where we discuss hot topics that we cover in my videos. Primarily, I wish to describe to you the processes involved with the treatment and diagnoses and management of cysts and lipomas before opening the floor to questions from around the world, which I'm sure there are a lot of questions you've already asked me, and there's a lot more questions that I'm sure you have in store for me. So a quick recap. I specialize in the removal of cysts and lipomas, and I carry this out from my London practice in the United Kingdom. We're based in Chelsea and Kensington in central London. And if you've got any questions or queries, you can contact me by email, on Twitter, or just messaging me online. You'll find the information in the bio. So I want to say hello to everybody for joining us this evening. It's great to see so many people from all over the world. And as you know, I very much appreciate everybody's support. So thank you so much for tuning in. So let's kick off. First of all, before we take questions from everybody in the audience, let's just take a look through some of the services that we provide in terms of the treatment. So the first thing we should kick off is really discuss epidermoid cysts, sebaceous cysts, pilous cysts, these kind of follicle cysts that we see so often in the skin. As you know, I tend to use some local anesthetic, so the procedure is done while you're awake, and it's the same kind of stuff that a dentist might use for a filling, for instance. So you shouldn't feel any pain during the procedure, but it does sting a little bit like a bee when it first kicks in, but then once the anesthetic starts, it disappears very, very quickly and you shouldn't feel any pain. I like to make a small incision, so we have to take the cyst out, and so the smaller the incision, the better the recovery, the smaller the scarring, and then we're able to drain the sac and then empty the sac in its entirety before closing the skin. In the previous videos, I've also discussed how to manage infected cysts through secondary healing, and also the suture material that we use in both cases. So if it's not infected, we like to use a subcutaneous stitch underneath the skin, and those that are infected, we need to pack it with a special silver impregnated ribbon that helps with the healing process. It takes a bit longer, but that's what we're doing. With lipomas, we do those in clinic as well. Those are benign fatty growths, and we just excise them again under local anesthetic. We put a stitch in, non-dissolvable stitch, and that usually results in a very good process. So enough of about what I do. Let's take some common questions from the floor. So please, if you've got any questions, just fire away. One of the most common questions I get is, why don't we wash out? Well, we don't wash out so much because I don't think there's really a need for it. Often a good clean out is sufficient, so we don't need to do that. We don't tend to do that here either. What made you want to become a doctor, says Rhonda Lee? That's a very good question, Rhonda. A decision I made a very, very long time ago. I was always fond of science and maths, and it seemed to be sort of natural progression from primary school to secondary school that I ended up doing very, very scientific college courses, which invariably led to a much more creative degree in medicine. And that's, I think, why primarily was my passion for science and applying that in everyday scenarios. And you get so much more with medicine. What was the largest lipoma you've ever removed? Well, lipomas vary in size and complexity, but we've had some big ones. We certainly have some very large ones. Hi from Glasgow, Doctor. What's your favorite type of cyst to remove? I like the face cysts because they're a bit more complicated, a bit more tricky. So I really get to put my surgical skills into use there. Why do lipomas form? Tracy, that's a very good question and a very difficult question to answer. Sometimes it can be just idiopathic, we don't know. Sometimes there's a family tendency for it. So if you if you've got other members of the family that get it. Sometimes it's trauma. You bang yourself, you carry your bag, you get it. I keep getting cysts or boils on my legs. What can I do? Nicola, that's a very common question. I think the first thing to do is go see your doctor, do some blood tests, make sure that there's nothing there too obvious. You can get a lot of infected cysts in pre-diabetics and diabetics, so that's always worth checking out. Why do you always remove lipomas? Do you always remove lipomas in the office? Well, it depends on the size and complexity. So we can do. What's this? Have you ever had a cyst yourself? Yes, I did. I had a little epidermoid cyst in my arm that I had removed. I should have filmed it for everybody to see. It was fantastic. In fact, I think it was a blackhead. There's a little dilated pore, which everybody loves so much. So yeah, we do get them myself. So more questions. I keep getting boils. Why do some cysts smell and some don't? That's a very good question. It depends on whether the skin's broken down and bacteria's gone in and the thing's started to decompose and rot. So if it's infected, it does stink, unfortunately. And some of them can stink really badly. Let's take some more questions. Why is it important to remove the sac? It's important to remove the sac because if you don't, it will just reoccur, it'll just close up, and those cells will keep producing the content again. Oh my goodness, I never knew that so many can be a sign of diabetes. Well, it can be, so just get that checked out. Obviously, I'm not saying that you do. Any plans to come across the pond? I would love to, Linda. You know, I'd love to link up with, you know, the Dr. Sandra Lee of the Pimp Popping World. Certainly, I would love to come to the States. Have you ever removed a big pore? Yeah, we've received some rather large pores of whiners, Susanna, and just check out the latest video. We had a really massive one on someone's back, and that came out beautifully well. If you haven't seen it, go check that out. Why do people wait until the growth is so large, says Donna Gunter? That's a very good question, Donna. I think a lot of people don't know how to manage it. They think that the management is going to be more than it actually is. So there's a lot of fear in coming into clinic and get that sorted out. And part of my job really is to make sure that people aren't scared, that they know what is going to happen, that they can see the videos. It doesn't take very long. It's pretty painless, and the results are quite very good. So yeah, definitely I think part of this channel is to educate people, make them aware that these cysts can be removed easily without problems. Let's take some more questions. Hello from, my husband has scars or something and they won't go away. It's been years. Okay, well, scarring is a problem following surgery. And invariably whenever you do cut the skin, that will happen. There are ways of treating scars. You can have laser therapy, you can have steroid injections. They all have variable results. So you really go and ask your local dermatologist. So let's take some more questions. People loving the program, fantastic. Thank you so much for supporting. This is Maria, hello from Minnesota. Love your live chat. Great teaching tool. Yeah, we did actually this new voiceover, which was wonderful, where we had a video and then I described the process of removing it live, and I think that went down really well. I'm also going to be doing a really nice compilation video for the 5th of November over here in the United Kingdom. That's Guy Fawkes. So we'll put all the big pops, all the big bangs together. We'll have some rapturous music in the background, and we'll produce this fantastic celebratory compilation video for everybody to watch. Let's take some more questions from the floor. Have you ever removed the lipoma from the collarbone? Yeah, we've removed lipomas from all over the body. Collarbone, foreheads, scalps, back, buttocks, legs, arms, forearms, you name it, lipomas can grow wherever. You're awesome. Thank you, Daphne. You're too kind. That's too kind. So let's have a look. Some more questions. What is the best skin cleaning product to use for dry skin? Ooh, that's a good question. I think you gotta find a product that works for your skin. I don't really advocate any products. I don't have my own product line or anything like that. But certainly go down to your local drugstore and try a number of products. Don't just stick to one. There's no need. Just try and mix and match. Find what works best for you. What other questions have we got here? Dr. Lee is Upland, which is only about 30 minutes from me. The two of you should get together and do a seminar. I think that's a great idea. Everyone go message her and let her know that we want to do a seminar across the pond. Let's flick through, see if we've got any questions here. Have you ever removed the cyst on yourself? Yeah, we've done that. Why do people leave it so long? I keep getting cysts and boils. Why do lipomas form? Welcome from Glasgow. What's the largest lipoma you've ever removed? Keep getting boils and cysts. I had a fatty benign growth and I divorced it. That's fantastic. Why did we choose dermatology over every other specialty? Well, the skin's a fascinating organ, you know, so it's probably the biggest surface area organ, and it kind of falls within my remit of surgical expertise, as you know, that, or you may not know, that I actually trained in OB/GYN before moving on to family medicine, and I moved across with my surgical skills into that field. Why is the treatment for psoriasis not evolved more? For example, coal tar, hydromol, and chemo tablets. You're absolutely right. There's not much scientific progress in a lot of conditions outside the big ones: diabetes, heart disease, cancers. So a lot of the research goes to the big ones, and then the smaller ones like skin conditions and other ones do get neglected, and the research does reflect in the lack of medicine. Why do you only do one stitch? Well, often the sutures, the cut is very small. And the thing to remember about stitching is that it's not there to strangulate the tissue, it's just to bring it into opposition so that it can heal. And if you put loads of them, you're cutting off the blood supply and you have a risk of the wound becoming necrotic, infected, and breaks down. So you just need a single stitch just to bring it together and let Mother Nature do its course. I like to do a very light touch in all of my surgery, so I don't like to put too many stitches in unnecessarily. I want to bring the skin to nice opposition. I want to have very good tissue handling and respect for the tissue. Make sure we don't use a lot of cutting or putting your fingers in. We use some blunt dissection, identify the tissue layers, and then put the stitches as needed. Real minimal effort surgery, not sort of go over the top and just bang in a whole reel and then the whole thing just doesn't look great. What else have we got there? At what point should someone see a doctor regarding a cyst? I think you should see a cyst as soon as you develop it. Do not wait for it to become troublesome with pain and tenderness. If you've got a cyst, you should go and see a doctor straight away and get it removed. And if they won't remove it, you come and see me and I'll remove it for you. Let's take some more questions. Let's have a look. Biologics, yeah, absolutely. Ganglion cysts are ugly, but do they need to come out? Well, ganglions are not pure cysts in the sense that you see on my channel. A ganglion is basically an outpouching in what's known as the synovial capsule. So between every bone joint is a sort of a cushion of fluid called the synovial capsule, in which the bones articulate on so they don't grind together. What can sometimes happen is that membrane, that synovial membrane, can weaken and you get an outpouching, a little bleb, like you might see on the inner tire, on the inner wheel of a tire, a little outpouching there. And that bleb on the synovial capsule is the ganglion. So it kind of protrudes outside the joint, it fluctuates in size. You can't take it out per se. You would need to either aspirate it, so put a needle, withdraw the fluid, or undergo major sort of joint surgery to have that capsule operated on. Not something I do, it's the preserve of orthopedic surgeons, you know, bone surgeons. But yeah, do not confuse a ganglion cyst with the kind of cysts that we do in our clinic. So let's take some more questions. What about blackheads under the armpits? Well, you know, blackheads anywhere are a nuisance, especially if, you know, they cause discomfort, you become self-conscious of it. So if you're suffering from those, certainly you should have those done. One of my patients that's diabetic has many cysts all over her body. Is it true that these are part of diabetes? I think, yeah, you've got to be careful with diabetics. They do develop cysts, they can become infected, so you should get that sorted out. Again, get your HbA1c, get your glucose, your random glucose tested, make sure that you're exercising regularly, that you keep your weight down. You know, metabolic disease is epidemic across the globe because we eat too much, we don't exercise enough, we have too much sugar in our diet, so you've got to be careful that you don't overdo it. You end up getting diabetes and then you get sick. Let's take some more questions from the floor. Sunscreen for a 4-year-old. Ooh, well, you know, in Australia, you know, the old adage of slip, slap, slop, you know, slap on a hat, slip on a t-shirt, and slop on some sunscreen. So it's not just the sunscreen, you've got to have the whole attire as well. Make sure that you are covered from those cosmic sun rays if you're out in really hot sun. One, because you'll burn. Two, because it sort of increases the aging process of skin. And thirdly, most importantly, if you've got a very fair skin type, it increases your risk of developing skin cancers like melanoma. So, next question. What do you recommend for scars that are left behind? How do you minimize scarring? Well, I think the best way to minimize scarring is to not operate, obviously, because if you cut virginal skin, then the body has to repair, and that results in fibrotic tissue being laid down and invariably scar tissue. So if you are going to have to go under an operation, make sure that you see a good surgeon, like myself, but also I think you've got to have a balance between an access scar, so the size of the scar, and the operational needs of it. So making sure that the scar is a reasonable size, make it nice and small, and then making sure you put a subcutaneous stitch. I love a subcutaneous stitch. That's a little running stitch that goes underneath the skin. I prefer to use a non-dissolvable so it doesn't react with the skin, and then we'll just take it out after 7 to 10 days, and that usually results in a very nice scar. And obviously you need to have very good needlework to put the subcutaneous stitch in as well. And what you see, some people just kind of might sort of cut corners and put the interrupted stitches. That's the individual ones, like you might see on a joint of lamb. It causes scarring. It doesn't look so good. So yeah, just avoid that. Let's take some more questions. There's a hole in the ozone layer over New Zealand, so children have to wear hats. My daughter teach. Yes, absolutely. So yeah, so I think the ozone layer is getting better, but you certainly need to be careful. How to get rid of bad scars that go from hip to hip? I think, you can try some laser therapy, you can try some steroid injections. There are specific other injections that can eat up scars as well. You might want to look into that. Let's move on. Let's have a look. What else is on here? I'm a truly Dr. Pimple fan and now Dr. K fan as well. Thank you so much, Linda. You're too kind. Will you be able to help, as it affects me greatly, helping my hydrosis? Well, hyperhidrosis is a skin condition where the skin sweats excessively. We all sweat invariably when we exercise or when we're anxious, because that's the way the body responds to stress or heat to try and cool us down. But in some people, that sweating process is overbearing and results in continuous sweat production, which obviously is quite distressing if you're constantly sweating. It's a very difficult condition to treat. There are these aluminium compound roll-ons that you can use in conjunction with antiperspirants, but in more severe cases, you may need to use Botox injections, and they can go into the axilla, into the armpits, or the scalp, or the soles of the feet, wherever they need to be. They don't last forever, and they will need topping up, like most Botox. And you'll know that Botox is a botulinum toxin, which will paralyze the muscles as well as the sweat glands. So that will reduce the hyperhidrosis or the excessive sweating that you may suffer from. So if you have not had any success with just over-the-counter antiperspirants or the aluminium roll-ons, then the next stage would be to undergo a Botox injection. And again, they're not curative, it's just symptomatic relief. Let's take some more questions. My son has cystic acne. What causes this? It's horrible. Well, teenagers undergo a lot of biological change, a lot of hormonal changes, and this can manifest in acne in boys and girls. I think the first line is to use a peroxide facial wash, especially if it's affecting a single area like the face. If it's affecting multiple areas, the next step up would obviously to take an antibiotic like a tetracycline or a limacycline. And if it's severe, causing pitting and scarring to the face, then you've got to step it up and take some Accutane. Again, consult your doctor about that before engaging in this. So do see a specialist about that. Can I remove skin tags myself? I have hundreds of them. Well, there is the wives' tale of tying like a string around the skin tag, leaving it for a few days, and the thing will just drop off. I've not tried it myself. I don't advocate it. I think you should see a specialist about that. It's easily done. We can use the electric hyphicator, that's electric cautery, to just kind of fry them off, or we can shave them using a shaving blade with some local anesthetic applied, and we get good results. So you can try the string. I don't know if it works, but it's there. Okay, what's next available for us on here? I'm suffering badly at the moment with restless leg syndrome in my arms too. Okay, I just had blood tests. Doctor said it could be neurological. Really, I think, Tina, restless leg syndrome is a condition that affects a number of people. I think the etiology is unknown. We're not quite sure, but certainly doing some blood tests to make sure the common elements that make the blood profile are normal. And now I mean your magnesium and your zinc and your potassium and your calcium, because these are all very specific elements that help contract muscle and send electric signals throughout the body. So definitely a full set of bloods would be imperative before determining what treatment you'd need for that. So definitely get the bloods done. 56-year-old, cut right through the muscle unless the horrible scars. Yeah, that's the hip one. Speaking from my own experience, I don't recommend trying surgery on your husband's knees. Cysts get infected. Yeah, absolutely. My son's got the opposite, doesn't sweat at all, very sensitive to heat. Well, that's the other side of it. Okay, let's have a look. Some more questions. Should milia be removed around the eye? Well, you can, of course, use, again, the hyphicator to take those out. But again, it's not going to cause any harm if you left it. So it's purely cosmetic, but if it's causing you distress, emotional distress, then by all means you should get that treated, because, if you don't look good, you don't feel good, that's no place to be in. So milia, yeah, absolutely get those treated. Let's see what else there is. Having seen the videos of Asians wipe stuff around gloves, I don't know what they're doing. Have you seen the videos of Asians who wipe stuff on their gloves? I'm not sure. I don't know what that is, Cal. What else? Let's have a look. Let's scroll up. Let's have a look. How do you get rid of bad scars? Yep, we've got that. There's a hole in the ozone. Yeah, so thank you for answering. Can you say hi to my daughter Kaylee? Yeah, of course I can say hi to your daughter Kaylee. That'd be an absolute pleasure. If anybody else wants a shout out, it'd be my pleasure. Another question from Mary regarding my patients with many cysts. She wants to remove, but I'm worried that having diabetes, stage 4 kidney disease, but stable other health. Okay, so to be honest, I think stage 4 kidney disease is quite advanced. You need to have a look at the medication she's on, especially if you're going to be applying some adrenaline and xylocaine into that. If you're in London, I'm more than happy to give you a free consultation. Swing by the clinic at the Smart Clinic in South Kensington. I'd be happy to give you some further advice. Can you say hi to me, Kerry? Hi, Kerry, how you doing? Really, I'm hooked on your videos. Well, that's most kind, Mayam. Thank you so much. They remove blackheads and wipe them on their gloves. Yeah, that sounds pretty gross, Linda. I don't know what they're doing. You're totally right. It's gross. They shouldn't do that. You should just put them in the bin and use some swabs. I'm getting really bad pimple in my underarm. How do I get rid of it? I think you can see your doctor and see what kind of pimple that is. Thanks for answering questions. So yeah, a lot of fantastic questions. I want to say thank you so much for everyone who's supported us so far. If you've got any more questions, I'm happy to take them. I'm going to go on for another 7 more minutes. I tried to remove a tiny cyst myself, but couldn't get the sac. I was afraid it was too big with a pair of tweezers. Your work and dedication to medicine is awesome. Thanks, Peter. That's really kind. My doc likes to put needles in my face. The med helps me. Okay, Marie, well, that's good. Nicole says, thank you. Going to England, top of my bucket list. Yeah, you guys love the tourist videos of England. So I'll try and get some more of those as a pre-trailer to the surgery. Absolutely. Absolutely love your channel. Debbie, thank you so much. Sammy, thank you so much. Marie, thank you so much. Nicole, thank you so much. I want to thank everyone for watching. Kim from Cork and Ireland, Donna, Pascal from Paris, Rhonda, Laura, Kat, Kerry, and Linda again. So many people, Tayaj Bash, Nicole, Mary, QB, so many people from all over the world giving their support. Sandy, Kel, and Kathy, thank you so much for support. Have you ever seen Meghan and Harry? Yes, I have. because we're based in central London, the royals typically are driving around in their motorcades, and so I'm often stuck in traffic, and then Queen Elizabeth rolls by, or Prince William and his family will also go by, and we're all stuck in the traffic, except they get the preference. They've got their outriders and they go straight to where they need to go. So why do miliary rise around the eyes of some people? That's a good question, Kat. So again, if we do have an answer, it may be around cholesterol. You know, xanthelasma is the deposition of fat around the eyes. And so if you've got high cholesterol, this can be sort of a skin manifestation of that. So you don't just need the blood, it can be also found in the skin. So that could be a cause. Hello from Germany. Eike, how are you doing? I would love to clip your suture strings. Well, Sandy, you're more than welcome to come down. Anna, thank you. Tina, hello from Savannah, Georgia. Thank you. M from New Mexico. Peter says, does working up a sweat help with the removal of blackheads? Ooh, not sure. I don't think it will. Love your show, Mary. Thank you. Thank you, everybody. And so what was this one? Oh, so many comments. Let's go back and read them. So Lorna, love your videos. Hello, Scotland. Nicole, what is the best skin cleanser for adults? I think, Nicole, you've got to try a different one. See what works for you best. How big is the biggest cyst you've ever extracted? Wow, Dennis. Oof, we've had some corkers. I think we had one that kind of squirted out, and it was like the size of an egg. If you haven't seen it, I think it's got about 1 million views. That's probably one of the biggest ones. And we also had that red hot chili pepper one, or red hot chili popper on the neck. That was quite large as well, and it's quite infected. But we've had some right big ones in our time. Dawn, hello. Canada, Lisa, fantastic. Mary, thank you for your response. Enjoy the videos. Absolute pleasure. Love your videos. Excellent, excellent, excellent. So look, absolute wonderful chatting to everybody. And do you have any family members who are also doctors? Yes. Yeah, there's a lot of doctors in the family. Is using a terry cloth for the face good enough to exfoliate? Yeah, I think so. I don't think you need to go get some wire wool and exfoliate. I think just wash daily, have showers regularly. Make sure that if you're wearing makeup, you take it off in the evening. Make sure you eat well, you sleep well. Sleep is really important, because if you don't sleep, the whole thing falls apart. So yeah, absolutely, a terry cloth is absolutely fine. You don't need to use any wire wheels. Do you watch other pin popping videos on YouTube? Well, you know, why not? You got it right. Everybody enjoys watching a pimple popping video. My son Sandy says, my son is paraplegic with multiple cysts on his back, and he does feel pain. Sandy, I feel so very, very sorry for you and your son, and I hope that you are looking after him and that he's looking after you, and I wish you all the very best. Kel, do you get Dr. Pimple Popper television program over there? I think it's on cable, because it's on Discovery Channel. I don't watch it myself, but I'm sure you can. I love your job. I don't speak English very well, says Pascal Falla, and relaxes me. Fantastic. Well, I'm so glad that the videos are educational and also therapeutic for a lot of you. Laura, you're adorable. Keep smiling and stay safe. Laura, bless you. I'm medical assistant here in South Carolina, says Kat. I would love to work in your office. Kat, you're more than welcome. Rhonda, plenty of nurses and 1 DDS. I have a cyst inside my eye, says Vladimir. Well, you know what? Schlazions, Mabian cysts, they're very, very common. Need to be removed by eye surgeons. I don't do them myself, but if you want to try and relieve the pressure and the tension, you can use a warm compress. So you just get a flannel, soak it, just put it in the microwave for a few seconds, and then just apply it to the eye for 15 minutes a day. That will help release the tension and remove the pus. So to get veins in my face. Yeah, I think, you know, spider nevi is a problem. And that's very superficial veins, and they can be treated again with laser or electric cautery. In Belgium, it's just gone midnight, and Pascal is going to bed. Good night. Nicole, thank you for doing this. Kelly and I appreciate it. Well, absolute pleasure. Great show, says Doris. Watch all the time. Thank you for watching. Couldn't do it without you. Marry me, Dr. Sadek. Cherie Bow as well. Yes. Kel, are you married? No, I'm not. Ladies, when is the next Q&A? Well, we're doing the Q&A now. I think we might do it every Sunday evening, I think, just before I go to bed here in the United Kingdom. You guys are enjoying your evening. Laser the veins away? Yeah, absolutely. Curious. So, just curious, my 5-year-old has tiny pimples on her arms and her cheeks, and I've tried cortisone creams. What else can I do? I don't know. I don't know what kind of pimples they are. But in that age group, there is something called molluscum contagiosum, which is a viral infection that causes really, really small pimple-looking skin lesions, very small lesions. It's viral in origin, contagious. Eventually, children do develop an immunity to it, and it settles. But again, you'd have to speak to a specialist near you to be able to identify that. So, I think we've had a fantastic evening today. Thank you for watching. I hope you found today useful. I think we'll do this every Sunday, perhaps. Remember to continue to watch and support. I've also got Dr. Khaled Sadek Uncut, where we're doing a lot of the background of the channels and the vlogging. So, with no further ado, I'll leave you all to rest. Good night. Bye-bye.